Hi, Dr. Z here. Today I want to talk to you about something that might seem redundant, but is nonetheless super important, and that is how stress impacts digestion. I personally have had many people coming to see me recently who are suffering from the physiological aspects of stress, and digestion is a major area of compromise. I think it's safe to say that most individuals have experienced an increased level of stress within the past year. I'm hoping that if you are someone that can relate to this, that this video can help bring more awareness surrounding your mindset at mealtime and your relationship with food. Not surprisingly, stress impacts several areas of digestion, namely the esophagus, stomach, small and large intestine. Let's first talk about esophageal motility. In normal esophageal motility, smooth muscle contractions allow the bolus of food to effortlessly move down towards the stomach. There's an upper sphincter that prevents too much air from being swallowed, and a lower sphincter that prevents gastric secretions from refluxing back up into the esophagus. Stress, however, can increase the occurrence of esophageal spasms, and this sensation can often be confused with a cardiac event because the sensation feels like general chest pain sometimes. Gastroesophageal reflux is also known as GERD, and hiatal hernias can also manifest as chest pain, which of course is going to feel concerning and likely warrant a cardiac workup to rule out more serious causes first. Interestingly, a study showed that relaxation therapy significantly decreased both symptoms of reflux and total esophageal exposure to stomach acid. Moving on down to the stomach, as mentioned, the gastric motility is important because if your food sits in your stomach longer than it should, this could cause reflux and stomach discomfort. Normally, food entering the stomach stimulates smooth muscle relaxation to accommodate for the incoming food volume. The stomach contracts, on average, 3 times per minute in the mid-stomach to move food to the lower stomach. All the while, the stomach acid secretions are working to digest the food and emulsify it before getting to that lower part of the stomach. Someone who has insufficient stomach acid is going to have delayed gastric emptying compared to someone with too much stomach acid. Under stress, the body does not prioritize this digestive process. In fact, stress can decrease gastric contractions from 3 to 1 per minute. There's also evidence that stress alters pancreatic and gallbladder secretions, making it even harder to digest food, especially protein and fats. Moving on to the last areas of digestion, we're next going to address the small and large intestine. Similarly to the stomach, stress can alter the motility of the small and large intestine. It's no surprise that IBS, or irritable bowel syndrome, is associated with anxiety and depression. In the small intestine, altered motility, especially in combination with low stomach acid, can open the door for what is called small intestinal bacterial overgrowth. Check out more detailed information in my previous blog video because this condition is all too common and results in a lot of discomfort. In the colon, or the large intestine, we now have, or should have, stool moving through slowly with contractions happening every 25 to 30 minutes. In a stressed individual, colonic motility is increased, as well as in IBS-D, or the diarrhea subtype of IBS. Anxiety and stress can also exacerbate the constipation type of IBS, which is thought to be in part caused by tension of the pelvic floor muscles. There are also some long-term implications that stress can have on digestion, such as altered intestinal permeability. The intestinal lining is so crucial to health because it secretes protective mucus, enzymes, and secretory IgA, which is the immune defense system. This helps to excrete toxins, wash out other irritants, and really make sure that that barrier stays intact. Interestingly, a study with college students revealed that during stress from exams, college students have less lactobacillus compared to non-stressed peers who are not taking exams. Hopefully this detailed overview of the main parts of digestion and how they are impacted by stress helps paint the picture of how important it is to unwind before eating. In my next video, I'll talk more about helpful implementation strategies, but for now, please take the extra 30 to 60 seconds to stop thinking so much, take slow, deep breaths, chew your food thoroughly, and stop eating when you're satisfied versus overly full. While eating, concentrate on how delicious your food is with every bite. And it's also helpful not to overload your stomach with a lot of liquid, so try to keep beverages designated to mostly in between meal times. I hope that was helpful to get you thinking more about how you can take control of your digestion. Until next time, be well.